Thank you for joining us on the podcast about miscarriage with Vanessa and Alex. Today I'm joined by Tanya, who's help me again with your title, perinatal nurse
Yes.
and doula.
Yes.
Is there anything else? I feel like there's more.
Birth coach, whatever you want to call
Birth
it.
coach.
Yes.
To talk about miscarriage and the feelings that go along with it, the anxieties, and also what's happening in our bodies when we do miscarry. So thank you for joining us, Tanya. Vanessa and Alex both experienced miscarriages two very different ways. Alex, was at like a major family event and didn't really have time to cope with it. And Vanessa was on a ski trip and kind of, I guess, chose not to cope with it in the same way. I'd first like you to explain to us, not why we miscarry, because nobody really knows why, but like what happens in our bodies to miscarry.
Yeah. So we don't know why we miscarry in a lot of situations, but sometimes we do. So we know that in general, when we were talking about miscarriage and when we talk about the incidence of miscarriage, meaning how many people like in Canada or specific population have pregnancy loss, it's a lot more common than we think, first of all.
Okay.
In Canada, it's up to 1 in 5, even 1 in 4. And that's only the miscarriages that we know about, because you can have miscarriages or miscarriages that you're not even aware that you've experienced. So the incidence is probably even higher. So that's the first thing. So second thing, why? Why do people experience miscarriages? Well, there's several reasons. Most common being some kind of chromosomal anomaly, where when the sperm and the egg meet and the cells begin to divide to form an embryo, there's some kind of error in the division of cells, which leads to an embryo that could not continue to grow in a, quote, normal manner, develop all the organs in order to function as a baby outside the womb. But there can be other factors like some kind of physical or anatomical anomaly with the uterus. Some people have uterine septums or things like that. Certain infections can cause miscarriage. Those are kind of like the more common ones. And then there's definitely a proportion of miscarriages that don't ever have any resolution in terms of figuring out the reason behind it. But it is very, very rare that any miscarriage is ever caused by something that the pregnant person has done.
Yeah.
Barring things like, hard drug use or excessive alcohol use, which can contribute. Things like exercising in the first trimester, having intercourse in the first trimester, working, all those things have not been shown to cause miscarriages. Okay. So we'll get rid of that off the bat.
So it's nothing that the mother has done
Absolutely,
wrong.
Exactly, absolutely not. So that's the first thing. And then remind me what your second question was? What's happening in your body?
Yeah.
Okay. So when the body detects that there is some kind of anomaly with the pregnancy, which would not allow it to be carried to term, whether that's a chromosomal thing or a physical thing or an infection thing, then the body, the uterus, gets a hormonal signal to expel the contents of the uterus, so the pregnancy, the embryo, and the placenta. And in order for that to happen, for the most part, women will experience some extent of cramping, which is essentially the same thing as labor contractions, where the uterus is this big hollow muscle and the muscle fibers will contract to push out the contents.
Okay.
And then that is often accompanied by bleeding.
Okay.
Right? So the bleeding being from the placenta detaching from the wall of the uterus, but also tissue, right? Actual tissue and clots are passed, which are the placenta itself and the embryo itself. So I think when Vanessa was mentioning that she had more of like an acute bleeding episode with a large clot, a large piece of tissue that came out when she was in the bathroom.
Yeah.
It can happen that way. I think in Alex's case, she had more of a progressive bleeding where it started kind of not so much and it increased over time over several days.
Right.
So both things can happen. In certain circumstances, you can even not have any bleeding and arrive at an ultrasound and find out then that things have slowed, and eventually you may have cramping or bleeding. And if nothing happens and the pregnancy is kind of just sticking around, even though there's no progress in the growth of the embryo, then sometimes medical management becomes necessary. So things like being prescribed pills to cause contractions of the uterus, and occasionally a surgical procedure called the DNC,
right.
Which is essentially a procedure where the medical practitioner will go and remove manually through the cervix the contents of the uterus.
So this leads to my next question is, for mothers, even first-time mothers or a mother who has never experienced a miscarriage before, what is something that they can look for? Like, what are red flags because, Alex and Vanessa were saying, had I known before, what kind of bleeding is not normal bleeding, or what kind of cramping is not normal, like what to look for before we say, okay, it's time to go to the hospital, because that's not something that we're taught. Like, we even in our prenatal courses, miscarriage is not even talked about. And I think it should be, because like you said, it's so, it happens quite often that that women miscarry, yet we don't know what to look for and we don't know how to manage it. And let's not even talk about it on an emotional level, but just on a physical level. So what are things that we can look for? Like, what's an abnormal amount of bleeding,
Yeah.
cramping, or like when should we say it's time to go to the hospital? This is not normal.
Yeah. I have a ton to say about this. So
Perfect.
let's break it down. So before we get into that, I actually want to, I completely agree with you on the fact that there is definitely a lack of information and education for women of childbearing age about what can happen when you become pregnant, right? And unfortunately, in the healthcare system that we have, most people don't even get to meet with either an OBGYN or a family doctor or midwife, whoever is going to be following their pregnancy. They don't even get their first appointment till usually 8, 9, 10, or even later weeks of their pregnancy. So a lot can happen in those first few weeks, and it can be very stress inducing, right? And this is when people tend to go to Google and ask their friends, and can actually become very anxious about what's going on in their body and what to do and what kind of care to get. So definitely agree that it's really confusing, and it is unfortunate that we don't get any kind of even preconception information.
Correct.
Right? Like, wouldn't it be nice if everybody could just meet with a nurse or a doctor when they were trying to conceive to get this information,
Right.
right? So definitely agree with that. And then the second thing we were talking about was symptoms of miscarriage, right? What amount of bleeding is too much? Well, first of all, not all bleeding in the first trimester is necessarily a miscarriage,
Exactly.
which is really annoying to hear
Right.
when you're pregnant, because the answer is always it depends. Maybe yes, maybe no. So it's very hard, like as a blanket statement, to give advice like that.
Right.
But what I will say is, if the bleeding is not excessive, if it's only spotting, if it's pinkish, sometimes it could be things like what we call a subchorionic hemorrhage, which can actually even lead to a lot of bleeding, which
Yeah.
is like a side topic, where like there's a little bruise essentially, or blood that collects between the placenta and the wall of the uterus, which can eventually come out through the vagina. Not necessarily a problem for the pregnancy. A lot of them resolve by the end of the first trimester, the second trimester. Some women have what we call a cervical ectropion, which are the cells that line the inside of the cervix that tend to grow on the outside of the cervix. And for whatever reason, those can bleed as well.
But this doesn't lead to miscarriage. None of
No,
these things. Okay.
exactly. So
That's
like
just
I'm just talking
bleeding.
about some of the reasons
bleeding.
why some women might bleed, where it would be benign or not
Correct.
necessarily a problem.
Okay.
But if you do get bleeding that is excessive, and what I mean by excessive,
Like
for the
period
most part,
bleeding.
or heavier. So what people will usually say is more of a medical emergency, where you really want to head to the hospital sooner rather than later, would be if you are wearing a menstrual pad, like a period pad in your underwear. And when I say pad, I mean like an actual maxi pad,
Yeah.
not like a little panty liner,
Yeah.
an actual maxi pad, and it is filling with blood and or clots within an hour or less.
Okay.
That would be considered excessive bleeding.
Okay.
Now, that being said, if you're filling a pad in 2 hours, that's still quite a lot of bleeding.
Right.
Again, doesn't mean necessarily that there's like a giant problem, but it would warrant a visit to a medical practitioner that day if you can. So if you have easy access to an OBGYN or your family doctor, and you can get a same day or next day appointment, then you can definitely do that. Because everybody knows that unfortunately our emergency care system, the wait times are quite long. But if we're talking about you're soaking a pad, like really soaking it in an hour or less, you should head to the emergency room, your local one.
And cramping as well?
Yeah, so cramping, once again, right? How bad is this cramping? Is it always a miscarriage? Not necessarily.
Right.
Some people experience implantation cramping, or just no reason, right?
Yeah.
Cramping.
Yeah.
As the uterus is growing, right? It's stretching. It can feel uncomfortable for some people. But definitely if you're having really intense cramping that is not being alleviated by taking Tylenol, applying, like a warm pack, like a Secmagic or a rice bag to the front of your abdomen or to your lower back. If after several hours of doing that, hydrating, making sure you're eating, you're not feeling better, and in fact you're feeling worse, it could be a sign that maybe something is going on and would warrant probably a visit, once again, either to your provider if you can see them rapidly, or to your local emergency room.
Mhm.
So I would say very heavy bleeding, soaking a pad in less than 1 hour, or really severe cramping where it's becoming more debilitating, right? Like you're not able to continue with your daily activities. If you're trying to work, it's really distracting. You try to take a nap and you can't sleep. It's waking you up in the night.
Mhm.
Those kinds of things would warrant an investigation.
Mhm. And is it true that for most miscarriages, you would have to look for some sort of something that you're expelling, like through your vagina? Like, is that like a 99% of the cases? That's what
So
happens. Like, you
not
will see
necessarily.
something in the toilet at some point.
Not necessarily. Kind of again, it depends on the situation. Like for your friend Vanessa, that's what happened, right? She said you really can't miss it, right? Like I could not have missed what came out in the toilet, right? It was like a much larger clot than
Yeah.
what I'd ever passed before. And then in Alex's situation, it was more of a progressive bleeding that got heavier, and I suppose she passed tissue at some point.
Right.
So it's not always going to be like one large clot or piece of tissue or an actual embryo that you can see. Depends on the stage of pregnancy,
Mhm.
right? So if you're quite early, right, the first like 6 weeks, sometimes whatever size embryo you had is not even that noticeable, and you would just bleed in the bathroom, in the toilet, and flush and not notice,
Right.
which can come with its own set of emotions, right? Like
Absolutely.
this conversation can go like to so
Yeah.
many different
Yeah.
levels. So not necessarily, but really what's important is to watch your own symptoms and how you're feeling. And if you're feeling really unwell and you listen to your instinct, if you feel like something's off, it's definitely worth going to the hospital. And that being said, other reasons that would warrant going to the hospital in a more emergent capacity would be a fever. So, if
Okay.
whatever you're experiencing is accompanied by a high fever, like 38 degrees Celsius or higher, if you're having chills, right? If when you go to the bathroom, you're having vaginal discharge or bleeding that smells foul, like fishy or just not right, those could be signs of infection inside the uterus, which would require medical attention really quite quickly.
I remember I had a uterine infection after I gave birth to
Oh,
Maddie.
yeah, that's
The cramps were unbearable,
that's not fun.
and I went to the hospital, and I thought that I thought that someone, like, forgot, like, a tool in my stomach
Oh,
when I was delivering, or, like, a piece of cloth or something. Because after you deliver, they count everything to
yeah.
make sure.
That would be
It's
really rare. It
scary.
would be unlikely,
Yeah.
but what can happen sometimes, and the reason why you'll get this information from your postpartum nurse, right? If you're passing clots larger than the size of a golf ball or an egg, go back to the hospital. It's because sometimes it's actually a piece of the placenta that
Okay.
stayed behind,
Right.
and that can cause problems with
Okay.
excessive
Okay.
bleeding.
That was just, like, a little side note.
Yeah,
But,
but it's all like it. There really are a lot of parallels with miscarriage and actually giving birth,
yeah.
right? Because the process of what the uterus is trying to do, expelling your baby, is quite similar, right? We're just talking about a uterus and a baby that are much smaller at that point.
Yeah. And then I also wanted to talk about just a little bit about, like, the emotional side of the miscarriage. So I just Vanessa seemed to kind of move on, like carry on and move on.
Mhm.
We'll just try again.
Yeah.
And Alex was really affected by it, and thinks about it every day. She
Mhm.
says, and because there's like a certain hope when you know about, like, you're gonna have a baby. You've like Alex said, like, you plan a name, you plan a room, and then to know I think it was at 8 weeks she miscarried, which is not a small amount of time. Like, you find out
Mhm.
you're pregnant at 4 weeks, so
Yeah.
that's like a month later.
Mhm.
You've known you've been pregnant for a whole month,
Yeah.
in her case. So um that I can see how that can be quite difficult um to deal with. So I don't know if you've experienced in your line of work, like, in the first trimester, if you have had moms who have miscarried, and how you've seen them cope or deal in different ways. If you can just kind of touch
Yeah,
on that. Yeah.
absolutely. So we've talked about this before,
Yeah,
like
yeah,
in
yeah.
another context,
Yeah.
but there are many different ways that people deal with miscarriage,
Yeah.
and even broader than that with grief,
Yeah.
right? Because miscarriage is considered a loss 100%, and people deal with it differently, right? The same way as if you have a family member dies, a parent, it's a loss in your life, and nobody deals with it the same way as anybody else. And all the reactions are valid and normal, right? So I remember when Vanessa was talking about her experience, she was actually tearing up about, like, not necessarily the miscarriage, but her reaction to
Reaction
the
to it. Yeah.
miscarriage, and feeling like she was emotionally stunted
Yes.
or some kind of robot and
Yes.
not feeling the way she should feel.
Correct.
And there really is no way you should feel. And there's such a range of different emotions that can be felt by different people when they experience pregnancy loss. And that can range from the more obvious ones like sadness, grief, confusion, discouragement, loss of control. But other people feel, sometimes, right, nothing, or they feel empty.
Yeah.
Some people can feel really angry,
Yeah.
a sense of injustice, right? Like, why me?
For
Why is this
sure.
happening? And some people sometimes even feel relief, which can cause them to feel guilty, right? In a whole chain of emotions, particularly for pregnancies that maybe weren't desired or planned. So there really is no correct way to deal with it. And it's important to give ourselves a lot of grace, and to welcome whatever emotion arrives and understand that everybody deals with it differently and that that's okay. And there are so many different factors that go into how somebody might feel, right? There's not normal and abnormal. There's just many different life contexts. People feel differently based on, again, if this is a planned pregnancy, how long have they been trying to conceive?
Yeah.
When do they, tend to get attached to a pregnancy? It depends for different people. Some people will feel very attached to their pregnancy from the moment they see that positive pregnancy test.
Mm-hmm.
For some people, they don't really
not
feel the
real.
concreteness of it until they feel fetal movements,
Yeah.
right? Or the baby moving.
Or
And
see an
sometimes,
ultrasound. Yeah.
or see an ultrasound. And then sometimes for certain people or even partners sometimes won't even feel like it's real till the baby's literally born,
Yeah.
right? And they have their child in their arms and they're like, okay, hello. So it really, it varies from person to person.
And it's funny because I remember, I forget if it was Alex or Vanessa who said a lot of people, or it's been said that, how can you grieve something that you've never met or that you've never, physically held or whatever. But I guess it's just the knowing, like that there was a possibility that's been taken away.
100%. And I don't necessarily even agree with that wording, right? You haven't met the person.
Yeah.
Well, perhaps you haven't physically met them.
Correct.
Right. But that's also true of women who are 40 weeks pregnant and haven't given birth. They
Exactly.
haven't met their baby
Exactly.
yet. But in a spiritual, emotional way, of
Absolutely.
course they've met.
Absolutely.
Right.
They're part of you.
You have a conversation with
Yeah.
your own body, with your baby
Yeah.
every day when
Yeah.
you're pregnant, right?
Yeah.
Many times a day.
Yeah.
So it is really a loss and a sensation of grief and a grief experience the same way as losing somebody who was already physically alive, right, as their
Yeah.
own individual person.
Yeah.
And for many people, it can actually be worse and come with a lot more baggage, because it's not just the loss of a person, it's the loss of an entire future.
Correct.
Right? So you've planned the baby names, and some people have already started to make plans with their
Yeah.
career and have started their nursery and their
Mhm.
baby registry, and telling different people in their lives, their friends, their family.
Or not even, but just thinking about it. Like
100%.
like when you're pregnant, like that's all you think about when you go to bed at night, and you start planning in your head at
Yeah.
night without even talking about it.
Yeah.
But it's always in your thoughts.
Yeah.
So it's like being kind of robbed of all those thoughts because they won't
100%.
happen.
Yeah.
You
So
know?
it's the loss of what could have been,
Yeah.
which is so difficult and different than losing somebody who's already been alive and
Yeah.
who has lived years and had experiences. It's feeling like you didn't get to have those things that you were anticipating
Yeah.
and looking forward to, right? Holidays with your children, how this child's going to fit into your current family if you have other children,
Right.
and how they're going to be best friends, and all these different dreams and hopes and things that people think about, and like veut veut pas, right? Like
Yeah.
we say in French, it's kind of an automatic reaction for many people to just start that whole process
Yeah.
of imagining
Of
and
course.
planning what things are going to be like, and for that to just abruptly stop,
Yeah.
it can be very destabilizing.
And I think also, just to kind of finish on, I think the guilt of, people say abstractly a little bit, like you did nothing wrong and stuff, but it's hard because when it happens in your body, it's like you're the only person who has control of your own body. So it's hard. Sorry. So it's hard to like imagine. It's hard to accept that you did nothing wrong because it could have been anything.
Mhm.
Like maybe I lifted weights too heavy one day, or like maybe I ate something that I shouldn't have, or like it's
Mhm.
really hard to, because as much as you can say it's not your fault, you can also say, at the same time, it really could have been anything else,
Mhm.
anything else.
Mhm.
So it's really hard, but I guess as like a scientific, you can confirm that, it well, I don't know if you can confirm because but
But I can in the statistical
yeah.
manner,
Yeah.
right? So I can't ever analyze anybody's particular
Correct.
pregnancy,
Yeah.
right? That's not my scope of practice to say
Yeah.
this is exactly what happened.
Yeah.
But what we do know is that there are literal scientific studies about miscarriage, right?
Yeah.
Because everybody wants to know, right? Does exercising cause this?
Yes.
Does having sex cause this, right? Lifting weights, working, like, should I stop working? All these things are questions that people have asked for many, many years. And we have data, right? We do have data. And there is no data that links, right? Lifting heavy weights or walking or
But as
exercising.
stupid as it sounds, it could even be like, I shouldn't have talked about abortion yesterday. You know what I mean? Like
Oh,
it can go that far.
of course.
You
of
know?
course.
Like
And
you can
it's a very common and normal human reaction,
Yeah.
right? To just feel that guilt and for some people to feel inadequate, right? Like, why couldn't my body do this? Right?
Correct.
What did I do wrong?
Yeah,
Like, what is wrong with me? What is
exactly.
And it's okay to feel that way, but
Yeah.
it's just really important to try to remind yourself and to take a step back when you can, or have somebody in your environment, right? Try to just remind you it's okay to feel that way and it's a valid way to feel, but to remember that that's an emotion, right? And that the objective facts are different,
Yeah.
right? A lot of times our emotions are not rational, right? And we know
Exactly.
that we know in our minds that we didn't do anything wrong, but in our hearts we still feel
Yes.
that guilt,
Exactly.
and that's okay.
Yeah.
Right.
Yeah.
So having a conversation with your healthcare provider sometimes, right? Because I'm saying this as a general manner, but for your specific health,
Yeah.
right? Having a conversation with your healthcare provider and telling them about your feelings and expressing what you're feeling sometimes can help get a bit of closure when you have your actual own doctor or own midwife or whoever kind of looking back on the experience with you and saying, confirming, right? Really, you have done nothing wrong. There was no reason to anticipate that this would happen. Just something that happens,
Yeah.
again, 1 in 4, 1 in 5 women. It is just unfortunately one of the facts of life and the facts of childbearing and reproductive age is that it is something that can happen to anybody in any circumstances.
Well, thank you very much, Tanya, for all
Thanks
your
for having
insight,
me.
and I really appreciate
My
it.
pleasure.